Hi, I'm Rita Batchley, the nurse's nurse, author, RN, and activist. I'm here to question, are nurses to blame for the bad news in healthcare? It would seem this would be the furthest thing on anyone's mind. After all, a recent Gallup poll deemed that nurses are the most trusted professionals for an amazing 14 years in a row. In fact, over the last 17 years, 2001 was the only year nurses came in second when firemen received the award after the 9/11 disaster. This award, voted on by the American public, is a lot to be proud of when you consider that nurses had some tough competition. But nurses won for having the greatest honesty and ethical standards over many other occupations, including doctors, judges, even clergy. So what gives? How can nurses be to blame for the bad news in healthcare? My answer, after 25 years of bedside nursing and healthcare activism, is this. While nurses aren't the cause of the failures of our healthcare system, we are guilty of not using our influence to impact the changes necessary to make our healthcare system great. Because let's face it, what's so great about being number one in a system that causes more than 75% of the bankruptcies in the United States? What's so great about an organization that tells the American people to use the emergency room for primary care? And what's so great about a structure that pays the most money per capita for healthcare, yet loses more lives to diabetes, cancer, and heart disease than any other industrialized country? To me, this is like being honored the Titanic Award. The levels of morbid obesity, unchecked mental illness, and deaths due to medical errors are disastrous. That would make any nurse's head explode. Instead of celebrating, nurses should be outraged that the richest nation in the world should give better care that the American people deserve. The most influential duty that a nurse has to improve healthcare is to stand up and say no to unsafe patient care assignments. In some states, there are nurse-patient ratios that will mandate how many patients a nurse can take care of at any given time. But hospitals across the nation use fear tactics to intimidate nurses to accept unsafe assignments. With 100,000 injuries or death caused each year by hospital errors, there's nothing ethical about taking on more patients than a nurse can handle. Nurses need to adhere to our Florence Nightingale oath to do no harm. While nurses have known for decades that the business of providing health care can't be run like an assembly line, we must learn to balance quality with safety and efficiency. The value of medicine is not in the size, as in the example of the Titanic. It is with the outcome seen in our healthy nation. RNs save lives, and whistleblower protections must be upheld to protect nurses who tell on employers who knowingly place patients in harm. Being a nurse is a calling that is ruled by a higher law. It takes integrity to do what's right, even when it's not easy. Like remaining calm and positive after a patient has received the worst news of their life. Nurses care for you and value you, even when you don't feel worthy about yourself. As elections draw near, look to the nurses who endorse the candidates that challenge the price gouging perpetrated by the pharmaceutical companies, insurance, and hospital industries. So it's no wonder nurses were voted the most ethical and trustworthy professionals, because we have to be. Patients, their families, and the public are counting on us to bring that values of caring, compassion, and community. I'm the nurse's nurse.